Gastritis is defined as an inflammation of the mucous lining of the stomach. It can be broadly categorized into acute gastritis and chronic gastritis. Acute gastritis involves sudden, severe inflammation. Chronic gastritis involves long-term inflammation that can last for years if left untreated. Erosive gastritis is a less common form of the condition. It usually causes mild inflammation. However, it can lead to bleeding and ulceration in the stomach lining. Gastritis doesn't usually cause noticeable symptoms in every individual. If present, most common symptoms include the following: nausea, vomiting, feeling full, particularly after eating, and indigestion. Additional symptoms of erosive gastritis include black tarry stools and vomiting of blood or coffee ground color vomiting. Weakness in the stomach lining allows digestive juices to damage and inflame it, causing gastritis. Having a thin or damaged stomach lining raises the risk for gastritis. Risk factors for developing gastritis include the following: heavy alcohol consumption, long-term use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin, cocaine use, advancing age, and tobacco use. Other less common risk factors include stress, autoimmune disorders, inflammatory conditions like Crohn's disease, and viral infections. Diagnosis of gastritis starts with history taking from the patient and physical examination. They may also recommend a breath, blood, or stool test to check for Helicobacter pylori infection. In addition, patients might have to undergo upper GI endoscopy. If left untreated, gastritis can lead to a variety of complications. Some types of gastritis can increase the risk of stomach cancer. Complications may include anemia, deficiencies in vitamin B12, vitamin D, folic acid, vitamin C, zinc, calcium, and magnesium, bleeding from stomach, perforation of the stomach, peptic ulcers, chronic atrophic gastritis, which causes the loss of cells in the gastric glands in addition to inflammation, gastric metaplasia and dysplasia, which are types of precancerous lesions in the stomach, achlorhydria, which prevents the stomach from producing the acid, cancers such as adenocarcinoma, mucosa-associated lymphoid tissue lymphoma, and neuroendocrine tumors. The treatment for gastritis depends on the underlying cause. Gastritis caused by H. pylori is treated with a course of antibiotics and several other medications, including proton pump inhibitors, which reduce the acid secretion in the stomach. Some common proton pump inhibitors include omeprazole, lansoprazole, and esomeprazole. However, long-term use of these medications, especially at high doses, can lead to an increased risk of spine, hip, and wrist fractures. It can also lead to increased risk of renal failure, dementia, and nutrient deficiencies. Another type of acid-reducing medications is famotidine. Famotidine lowering the amount of acid that's released into the digestive tract. These medications relieve the pain of gastritis and allow the stomach lining to heal. Doctors may also recommend using antacids for quick relief of gastritis pain. These medications can neutralize the acid in the stomach. Use of probiotics have been shown to help replenish digestive flora and heal gastric ulcers. However, there's no evidence that they have any impact on acid secretion. Following are some tips to prevent gastritis: maintaining good hygiene, reducing stress, eating smaller meals more slowly and regularly, quitting smoking, and avoiding or limiting alcohol and caffeine intake. It's important to prevent gastritis before suffering from gastritis. Thanks for watching.